If you're looking into becoming an RN, you must work to comprehend everything that's going to be expected of you as a specialist. Different facets of registered nursing result in different job specifications, changing the way you may view the overall expectations of a nurse. Trying to fully grasp each registered nurse job description will enable you to better understand which area of nursing you want to target and make a career out of. Usually, nurses help patients to provide them with their fundamental care needs. Some nurses will work in hospitals, while the majority of nurses will work in physicians' offices. Work requirements for each nurse will change based on the area that they're in, the training they attained, as well as the amount of time in occupation. A few of the common job expectations of the registered nurse include documenting vital signs and logging patient details. Nurses may need to review symptoms to help analyze the patient's issues with the doctor. Some nurses will be able to assist doctors with diagnostic tests, giving a more hands-on type of care. Certain nurses in these environments will be given more duties. Some nurses will have the ability to administer medications and particular types of treatment to the patient. Nurses will be asked to consult with patients to help them better understand these treatment plans as well as the medications they'll be taking. They must also advise patients on any specific diet or exercise requirements or limitations they might have. Certain nurses are also required to help patients with physical therapy, showing them the moves they must make while at home to guarantee a complete recovery. There are numerous types of nursing care which some individuals acquire specific certification and credentials for. For example, critical care nursing and emergency trauma nursing. Critical care nurses work with individuals who need to be checked often. Emergency nurses work in hospitals and emergency centers to initially assess the status of the patient who has been brought into the emergency room. Some people who wish to take on even further schooling and more important jobs will continue to work to become an advanced practice nurse. Advanced practice nurses will focus on a certain niche to become a nurse anesthetist or a nurse midwife. These types of jobs are a whole lot more hands-on compared to the average nursing position, hence the extra education requirement. These nurses are going to be expected to offer care to patients and will be expected to distribute medications. Many are able to prescribe medication for their patients. This depends on the state that the individual practices in. It's impossible to narrow down the field into a single registered nurse job description. Even the same exact nursing position across the same state will change depending on the type of care facility the job is at, in addition to the expectations those employers hold. If you're curious about nursing, talk to several nurses and different healthcare locations and ask them about their nursing job opportunities and the job descriptions of these positions.